policy pressure. And so it's easy just to forget that we're here because of children and families. So let's begin with centering on children and families, and beginning with our presence. So, we're all coming from different places with common goal in mind, right? And the roles and our pressures, our deadlines, um, it shapes how we show up in the spaces like this, right? And so today we're going to open up with a short reflection to kind of release any barriers, or anything that we're bringing into the space. All right. So, again, if you haven't already, please go ahead and grab something to write with, a quick note. And we're just going to first begin with a silent reflection. First, taking a moment to reflect inward. It's always good to start off with a deep breath in and a slower exhale out to fully step into the space and be present. So let's collectively just take a deep breath in and exhale out. As you're coming into the second one, specifically pay attention for anything that is coming up. That is what I like to call like low vibrational energy, right? So that's any negative anxiety, anxiousness, fatigue, frustration, skepticism, guardedness. Okay. As you're noticing those come up, really be intentional in your exhale about releasing them and forcing them out. Okay. So, one last collective breath in and a slower exhale out with the skepticism, the frustration, any tension, any doubt. So, first, as we're turning inward, I want you guys to ask yourself, what's something that I want to, should, or need to set down today so that I can show up fully in this space for this topic, for this community? Okay. So this could be doubt, fatigue, stress from earlier, an urgency to have all of the answers, specific urgency to address things, personal issues, parenting challenges, whatever it is that's coming up the most, take a moment to write that down. Really being intentional that as we're writing it down, that we're really setting this down on this piece of paper, at least just for this time.
You wanna just use one, right?
And I'll just give you guys a moment to write that down. Okay. Now ask yourself, what might I be bringing in, maybe without even realizing, that could act as a barrier today? So we had those first things that initially came up. We got those out. Now be more intentional about thinking about it. And then if you do have a piece of paper, if you wrote it on a piece of paper, if you're able, flip that piece of paper over. And on the other side, write at least one positive thing, high vibrational energy aspect that you could bring into this space, something that would be beneficial, right? So these are things like offering solutions, um, compromising, compassion, understanding, open mindedness. Maybe you want to bring inquiry into the space. All right. All right. Lastly, want you guys to go back inward into centering yourself, holding in your mind's eye what is upright. What high vibrational energies are we bringing into the space today that you wrote down? Okay. And as we take this last collective breath, we're breathing in not only our high vibrational energies that we wrote down, but we are trying to channel everyone else's and absorb them too. And our exhale, we will be releasing any stagnant energy, any of that lingering urgency for what we flipped over to resurface. Okay. So we're all going to inhale harmony, collaboration, going to exhale and release any stagnant energy, guardedness. All right, let's do this, brilliant people. We have a lot of things to tackle on our agenda today. Um, I'm just asking that we just stay present, we stay open, and we stay rooted in the why, right? And remember what I mentioned when we first joined here, children and families, children and families. All right, I'll pass it over to Shannon.
Hi, everyone. Excited to be with you all today. So our agenda, we're gonna start with our work group share outs, and then we'll take a break and we'll come back and have uh, the Juris Committee folks come and update us on the work that's happening over there. And then we'll take a break and we'll come back and we're gonna have Elisa join us from ODHS to give some updates. And then we will go back into having some work group time to sort of organize for the next meeting that you all are going to have this month. And then we'll close out for the day. So for our work group share outs, we also we wanted to try giving you all like 5 minutes in your work group actually to just check in with each other about what you wanted to share out today. I see some nods that might be helpful. So we'll have you step into, I'll put you all into your work groups for like 5 minutes, and then we'll come back and do the work group share out. And really, we can see in the notes that like some folks are getting towards like we've got an initial set of recommendations, or our like homework was to sort of bring together a vision, like people bring their vision for what would be some of the recommendations. And so if thinking about kind of in that theory of change that we created a while ago on the Miro board that I'm now on the wrong tab. There we go. And then in your folder in Dropbox, there's sort of an outline of what this would be, sort of the like outcomes, and then like the recommendations, the interventions that you all are thinking about. So thinking about kind of speaking to some elements of these, whether you're at the visioning stage or you're at the like designing some recommendations or ideating some recommendations, or some like resources or things that you are feeling like are needed. Speaking to some of this in your updates would be great. All right, so I'm going to open all the rooms and then we'll just come back in 5 minutes. Awesome. Hopefully that was a generative 5 minutes to just sort of get organized on sharing out to the whole group. So we've got about 30 minutes, so we'll try and keep it about 5-ish minutes each for the updates. And then if people have some questions or clarifying questions from any of the other work groups, we'll do that. So Justine, I know you had just popped in, but does that need a response system? You guys want to go first?
I would love if another group would go first, and then we can, yeah, Sarah, you and I can kind of get us going when it's our turn. Thank you.
Yeah, absolutely. Yeah. Debbie, do you want to funding streams? You want to go?
I was the only one in my 5-minute breakout group, but the update from the funding sources is Amelia Kucher, who is a part of this work group, was able to reach out and talk with someone from North Carolina who is involved in like the National Children's Alliance and such, and look at their model. He was talking about they were able to come up with like a case rate that was pretty generous, and they worked it through their version of like OHP, and it has been very successful for serving the PSP population or CSP population. So he's going to share that information with us to take a further look at that information. And the other thing is I didn't check this week, but we are still waiting for feedback from the different work groups to incorporate that into the funding proposals that we're coming up with. So we'd love to get that from the different work groups to incorporate, and we're going to continue to look at some of the models that have been successful in other states. That's it.
Thank you, Debbie. Annalise, do you want to talk about community education, where you're at?
We kind of are stalled out because no one's attended the last couple meetings, and I've been a committee by myself. So we did get our survey results back though, and the survey was very helpful in determining that there isn't a whole lot out there for most of the state. And so we've got huge gaps. There really isn't a lot of training or education available to families or to practitioners. And we're going to be starting at ground zero for most of the state and for most of the practitioners. So it's going to be, we're just going to need to make sure that we lay some foundation in the report to the legislature that addresses the need for a wide spectrum of educational delivery systems to use this topic and to create education for practitioners and for families, and to have available by some practitioners that those education pieces as well. So just there's a lot of work to do.
Thanks for that, Annalise. That's really helpful to hear. I had a follow-up question. Do you want the survey to continue to go out? Like, do you want another push of the survey out that we should ask for of folks?
No, I think we have almost every region of the state represented.
Perfect.
So I don't think, and we had a good survey return, right? A good number of respondents. The respondents though largely said, I'm not aware of anything. There doesn't seem to be anything out there. There is nothing out there. So good
Yes, good starting point.
response rate, good return of responses, right? People answered the questions. The problem is that Oregon just, like for childcare, for instance, this is a topic that is never, ever covered. There just isn't something for family childcare providers or centers. And unlike schools that have rapid response teams and things like that, and resources, child programs largely have nothing. There's a director or there's a single provider operating in a home. That's it. So the supports and things that are there are lacking too. So yeah, there's just a lot of work.
Quick question, if that's okay. Yeah, I guess first of all, just about the survey, I know I failed to fill mine out. Is it still open and would you still like people to respond to share more?
Sure, it's still open and
Okay,
yeah,
fabulous.
it's
Well, I will
open
plan to do that.
and people respond, people can still respond. But we did get, I mean, we got I think we hit most of the state. I'm really surprised.
That's awesome.
At the coverage that we have. But yes, if anyone can still complete it, that would be amazing. Right? Because you might know something that someone else that lives in your region did not know. So that would be great.
Absolutely. Perfect. Sounds good.
Yeah, and it sounds like yes, Ashley, I'll put the link in the chat and we'll send out the survey again. Yeah. And then it sounds like Jesse, the developing community and mental health resources, has some ideas too around education. So I wonder if Annalise, particularly because your work group is small and has had a number of scheduling challenges, that if maybe a little cross work group conversation we can make happen to
that would be great. That would be great.
Yeah, and I mean, I would just highlight as well, like in the system response work group, right? We've really identified that, like, yeah, the education piece is critical, right? With that first step of even identifying if a behavior's a concern. So we definitely have support that work, and I think probably have some ideas that would be helpful or relevant as well in thinking about some of the audiences that are going to be identifying those behaviors to start with as kind of that first step of a system response.
I wonder if it would be helpful, because it sounds like there is so much overlap between groups, to have, like, I don't know if everybody would want to join or just like the leads of each group or whatever, but like have all the groups get together. Because yeah, I think kind of like what we've talked about is like not wanting to recreate the same wheel. Like if it's already there, like one group is already working on it, like we can look at something else, or I don't know, just come together and have a little more clarity on what everyone is doing might be really helpful. Cause yeah, it sounds like Justine, y'all are doing that. We're doing that. Annalise, y'all are doing that. So a lot of great work is happening, but it's being kind of siloed unintentionally.
So I'm saying yeses, and I'm wondering, or Jenin, like when? So if it would be good to do that during the later part of the meeting today when it's work group time, or if there's already a meeting that's scheduled for one of these groups and you want to invite the leads from the other groups later this month to come to that meeting.
Sorry, I'm not sure. Did you say Jenna or Shannon?
Oh, I was.
I think that was
Okay.
yeah. 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 So I think there's a few different things we could do. And so I like both of those options, depending on what you all would like. Our time, we have half an hour a little bit later today. Would that be helpful to use that time as sort of more collectively instead of in separate silos? We can definitely do that. Um, I see some nods. Yes, yes. I also Alana's got a hand raised. Yes.
Thoughts that I was thinking is it would be amazing to do that, but also I think inviting the leads to the meetings if we have them, because the other thing too is I think having too many people in a group, I think that was one of the intentions of breaking them down, is that you get too much and then you can't get anything done. So, I mean, I would love to hear that, but honestly, my opinion is if everybody can just invite the leads to their next meeting, then it would allow us to go in, listen, observe, and then we could essentially say, yes, we're doing this, no, we're not, and then bring it back to their work group. That's just kind of my opinion, because I would love to hear from everybody, but getting too many people, it is so difficult to focus for me specifically. Maybe not everybody else, but for me, it is.
Justine?
Yeah. Yeah, I appreciate that point. I definitely, I think that's helpful to think about how to make those meetings the most effective. But I would also say, I guess for me on the flip side, the idea of joining in potentially 3 additional meetings feels unrealistic. So I might advocate or suggest that maybe we kind of schedule a separate time that's maybe just the leads from each group or a couple people from each group, like keep it so it's not everyone necessarily, but we can kind of do that conversation that feels a little more realistic to me, but also don't want to like unintentionally miss out on information or voices that are important. So I think maybe we can find a next step that tries to balance those concerns.
I love that, Justine. I would be totally open to having all the leads. Love it.
Okay, so this is the people most impacted by this are the group leads. So if there's a thumbs up or a thumbs to the middle or a thumbs down to that proposal. Thumbs up, thumbs up, thumbs up, thumbs up, thumbs up. Okay, thumbs up. Great. Okay, so we will go about doing or helping to coordinate that with the leads so that you all can have time to connect. Also, in your infinite amount of, reading time that you have leisurely to go and poke about on Dropbox and see the other committees' meeting notes is helpful, but I understand not infinite amount of leisure reading times. So, okay, but that sounds like a great next step. All right. So then, Justine, are you feeling ready now?
Yeah, Sarah's going to get us started and then I'm going to kind of jump in.
Yeah, good morning.
Okay.
Our group is still really working on identifying the systems level infrastructure that's really needed to successfully both urban and rural respond to PSBs. So we're looking at, the roles and responsibilities of different agencies. We're looking at maybe what an MDT process, a multidisciplinary team process might look like, and like who and what agencies that we already have need to be involved, and then what is missing, right? And so we have spent our last few meetings talking about and digging into the literature review that was distributed. And we did upload our thoughts and feedback around that into our Dropbox. If you all would like to look at it, we shared it with the facilitators in ODHS yesterday. It's under our meeting notes, and we just have spent a lot of time on that because I think the definitions, the work of specific agencies, I think figuring out and the evidence-based practices that we're going to use and how we're going to define things is really crucial to the work that we're doing in designing systems, and probably everyone else's as well. And so we're really trying to kind of solidify that so that we can move forward. I don't know, Justine or other
Yeah.
committee members, if there's anything you want to add.
Yeah, I can add a few things, and yeah, again, just invite folks, put that in the Dropbox so folks can take a look at it. I think we continue to, as Sarah said, affirm that like no one system is ever going to be responsible for PSB. Like this is gonna, because of what we know about the population, and that these, you know, when we're talking about these behaviors, they're diverse. This encompasses so many different types of behaviors. It's never going to be something that is housed in one system. And so, as Sarah said, that's really why we continue to affirm like the importance of child abuse MDTs, because again, we have that structure in place, but also more generally than just that kind of specific type of multidisciplinary team, just a multidisciplinary approach and process. You know, Debbie mentioned kind of hearing from Amelia the opportunity to connect with Jeff Sidoli from National Children's Alliance, who's working out of North Carolina. So I was able to join that meeting yesterday with some folks from our state coalition of child advocacy centers, Jeff Sidoli from NCA, and then Amelia Siders, who works kind of in our Western regional. And both of those folks are folks who do trainings nationally, and they have led a lot of work around evidence-based practices and responding to these kind of with the CAC and MDT kind of perspective. And those are folks I've learned so much from. So just kind of, that was kind of some of the conversation too about really affirming the like role of MDTs and all of our agencies really kind of comes from their perspective as well. I think, yeah, as Sarah highlighted, and I think that we've given this update, you know, every time of like, yeah, as we're talking about all of our different systems responding, like that is a really big thing to try and get our arms around. And so are continuing to kind of move forward with the idea of having some specific recommendations for each of those systems, right, to kind of improve responses, as well as thinking about kind of how to portray and communicate effectively about like what that whole arc of a case or a system response would look like. Yeah, so those are kind of the other things we've continued to talk about, and have given ourselves the homework to discuss in our next meetings a little bit more about like what each of our dream process would look like, to again try and continue to balance the we live in reality, we know there are limitations, and really stay aligned with, you know, maybe the 10-year goal, or, you know, a future kind of long-term goal, what that would look like. So we'd also invite folks from other committees, if you want to just take a moment in the next few weeks to kind of write some notes out or share in a different way what your kind of ideal process would look like. We'd love to hear that. Feel free to drop it in our Dropbox as well. Yeah, other folks from the group, feel free to hop in and share, but I think that's kind of our overview.
Awesome, thank you. So it sounds like we're in like visioning stage, thinking about what those like long-term like dream process and sort of end state might be. So that's awesome.
And continuing to, yeah, kind of connect that to then what are the specific things right now, right? And I think the other piece that just came into my brain. Oh yeah, so excited to hear from the folks in New Jersey and ask some good questions about, I know we've read and discussed kind of the outline of their process. And I know, yeah, lots of great questions about like, how did you actually do this? And like some of those specifics around some of those recommendations that they've implemented. So looking forward to that piece.
Cool.
And just to throw out there, if there's any preliminary questions that folks have for New Jersey, they're also welcome to like receive that in advance so they can shape their presentation around that. We've gone over just some like boiler points with them, but if there's questions that you all have, please feel free to send them to Shannon, myself, or Reese, and we'll make sure that they get those.
Yeah, that's great. I'll definitely do that.
And I do also want to say that they gave a shout out to the committee, because New Jersey did the reverse approach where they started with just doing their pathway because they saw the need and this needed to be designed. And then now they're going through the process of getting legislative support. So they are really excited about coming to the committee because they're like, we can learn from you all about how you all started with that process, because that's now where they're entering into. So they're excited to come and learn from you all as well.
Awesome. Jenna and Elena, for community mental health, who's
Yeah,
up now? Because I know you all have like initial recommendations already, so.
yes, yes. So, I don't know if it's helpful for folks. If it is, I can share my screen and kind of show what we've written down, but if it's not, I can just speak. I don't know if there's a big, like, one way or another, but maybe I will just speak, and if somebody wants me to put it on the screen, then I can. I don't know if that's helpful, but I'll kind of talk about some of the ideas our group came up with and some of the gaps that we have really kind of like highlighted within the community and mental health resources available. So there's a ton of gaps, as we all know. We have identified that there are no services that currently exist for youth under 12, and the ones that do for the youth over 12 is the juvenile justice route, but there isn't a ton of prevention happening. I know that CACs are doing a great job of like doing the forensic evals and then recognizing these issues and then supporting them, but we don't have anything that's like solidified. And this is especially problematic in rural areas. So the access to specialized services in rural areas is like so incredibly limited, if existent at all. And in addition to that, there's no centralized hub for specialized services. So even if somebody, let's say in Tillamook County, was coming up against problematic sexual behaviors with a client, they don't have a provider to really support that. And then they'd also don't have any resources to even point their client to. So we thought coming up with an idea around like creating a centralized hub so that way anybody in the state can access the same information, even if we can't necessarily get providers in every single county, which I think ideally we would, but if we can't, like at least there would be all of that information for them to look at. We also talked about we need more clear laws that protect in this area and consider the unintended consequences. So if we look at like who's impacted, a lot of times like we think about the siblings, we think about the parents, we think about the initiating youth, but like school districts, kids spend most of their time at school, maybe even more so than at home. And I think there's a ton of need of support in school for teachers, admin, any support staff who are seeing these kids to really identify like what are normative or non-normative behaviors. Let's see. We also talked about the strain it puts on like ODHS system, after school or school programs, because of the increased risk, and it pulls on kind of like caseload. It creates more caseload for DHS, but then a bigger challenge because it's hard to place these kids because of the problematic sexual behaviors and because there's such a lack of education around it. So, and then of course the community network and support, like we know that if these kids don't get support earlier on and we're more preventative, it can impact their risk to continue these behaviors, which then impacts strains on the system, whether it's the judicial system, whether it's CACs, whether it's like trauma specific services. So really talking about a lot of the gaps, but we also looked at some of the proposed solutions. So we thought that integrating mental and behavioral health services into the community could be done through like a foundational level of understanding of problematic sexual behaviors. And that might look like creating a summary or like umbrella class for grad school students to go through. So many folks who've been through like a mental health master's program all had to take addictions at least one class, I think, at least in Oregon. That's what I think the what is it called? Not recommendations, but you have to take like a addictions course, a drug and alcohol course in order to graduate. And so doing something like that around human sexuality that involves a more nuanced look at problematic sexual behaviors might be helpful, because then everybody is leaving grad school with a pretty firm understanding of the foundations needed to treat these kids and really highlight wins